You know, if you're a parent, you have definitely heard of bronchiolitis. It's that respiratory illness that seems to show up every single winter, filling up pediatric wards. But what if I told you that the way we've been treating it is actually up for a major debate?
I mean, think about it. Bronchiolitis is one of the top reasons infants end up in the hospital. But are the treatments they're getting based on the latest science, or are we all just kind of stuck in old habits? That's the big question we're going to dig into today.
And the stakes here are really, really high. This isn't just some minor sniffle. We're talking about a massive strain on our healthcare systems and, honestly, a huge amount of stress for families. It's a big deal, which is why we have to ask, are we really doing the best we can? So, to get to the bottom of this, we're basically opening up a case file. Our whole investigation is built around a recent study that took a close look at 62 infants. These were all babies hospitalized for bronchiolitis during the 2024 to 2025 season. So this is a real-time snapshot of what's happening in hospitals right now.
All right, let's dive in. The mission here is pretty straightforward. We're going to look at the data from these 62 cases and see exactly what went down. What tests did they run, what kind of treatments did they get, and what can this teach us so we can do better next winter? Okay, so the first thing we find in the evidence locker is, wow, a ton of testing. A respiratory panel was done on a staggering 98% of these babies. That's almost every single one. On top of that, more than 40% had blood tests. It immediately makes you wonder, is all of this really necessary?
Okay, next up, hydration. When these little ones needed help with fluids, the go-to method was an IV, used in a massive 89% of cases. Only a small fraction, 11%, got fluids through a nasogastric tube, which is way less invasive. That's a huge difference, and we need to file that away for later.
And that pattern of doing something just keeps going when we look at meds. An incredible 81% of these babies were given nebulized saline. Then you've got nebulized adrenaline, you've got antibiotics. It's pretty clear the default setting here is to medicate.
So here's the kicker. You add all that up, and you get this number. 92%. Nearly 92% of all the infants who were hospitalized got at least one medication. A steroid, a bronchodilator, an antibiotic, anything. The philosophy seems to be, give them something. But is that really the right call? So we've seen this picture of doing a lot. Lots of tests, lots of IVs, lots of meds. But here's where things get really interesting. How does all this stack up against what the science actually says we should do? Well, to figure that out, we have to look at the official clinical guidelines. And their number one principle is that diagnosing bronchiolitis is clinical. It means a doctor should be able to figure it out with a physical exam and by talking to the parents, not by relying on a pile of test results.
And right off the bat, we see a huge disconnect. In our case file, 26% of the babies got a chest x-ray. But what do the guidelines say? They're super clear. Routine chest x-rays are not recommended. They rarely change what you do next and just expose the baby to unnecessary radiation.
Okay, remember that huge 89% number for IVs? Well, here's the clash. The common practice was to go straight for the IV line. But the evidence-based guidelines, they actually recommend the exact opposite. They prefer using a nasogastric tube first because it's less invasive and keeps the gut working. The IV is supposed to be the backup plan, not the first line of defense.
And this slide, folks, this is where it all comes together. It's just crystal clear. Nebulized saline given to 81% of these babies, the guidelines say not recommended. Salbutamol, not recommended. Steroids, nope, not recommended. Even antibiotics shouldn't be used routinely. There is a massive gap here between what's being done and what the evidence supports. So why are the guidelines so against all these common drugs? Well, it's because the science is just overwhelming. As this summary puts it, no evidence suggests that drugs can modify the course of the disease. Now, that can be a really hard pill to swallow. For doctors and worried parents, it feels wrong to not do something. But the research is firm. When it comes to meds for bronchiolitis, less is more. Okay, so you're probably thinking, wait a minute, if we're not supposed to do all those tests and give all those medicines, what are we supposed to do? Right? What does good science-backed care for bronchiolitis actually look like? The answer is two words, but they are powerful. Supportive, care. It's not about finding a magic bullet drug to attack the virus, because we just don't have one. The entire goal is to support the baby's own body, to give it everything it needs to fight off the virus itself.
So, what does supportive care actually mean in practice? It's all about focusing on the simple things that make a huge difference. First, nasal washes. A stuffy nose is a baby's worst enemy. They can't breathe or eat. Clearing it out is a game changer. Second, position. Just keeping them a little propped up helps them breathe easier. Third, smaller, more frequent feeds so they don't get worn out. And last, oxygen, but only if they really need it. It's gentle, it's patient, and it works. All right, let's wrap up this investigation. What are the big takeaways? First, diagnosis is clinical. Trust the hands-on exam. Second, we have to actively push back against unnecessary tests and meds that don't actually help. Third, our whole focus should be on simple, supportive stuff, like hydration and keeping their nose clear. And finally, we have to learn to trust that less is more isn't just a catchy phrase, it's the best science we have.
And that brings us to the big question for the future, right? We've seen this gap between habit and evidence. So what happens now? When the data comes in for the next bronchiolitis season, are we going to see the same charts? Or will we finally see a shift, a move toward doing less, and because of that, doing so much better? We'll have to wait and see.